the proposed changes in the health care plan mean to us?
The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
I don't know, maybe if I put my microphone on, you'd know exactly what they mean to us. Here, you know what? That happens every once in a while on this program. Welcome in. Some days are better than others. Nice to have you. The Republicans may feel that way as well, to be honest with you, because they think they got a big change agency going here, and now they're fractured on day one. We'll talk to somebody who's got a real keen understanding about this healthcare stuff coming up. Professor John Friedman joins us momentarily. Nice to have you aboard. Let's check the rundown and see what's happening. In the meantime, this is really fascinating. I don't know that the whole country's talking about this. Washington's talking about this. The cable newses are talking about this. But our threshold for pain for Donald Trump's, I don't know, acting out is just so high now that this hasn't gotten a lot of attention. Let's show the headline here. Republicans aren't supporting this. They're hoping that this all kind of goes away. Here's the latest.
I should hit an issue that I know is on the minds of many and that is controversial, so I should speak to it directly. I am a New York Giants fan.
The FBI director shrugged off the controversy.
I want to thank the members.
And there was no comment from President Trump Tuesday on his startling claim that former President Obama tapped his phones at Trump Tower during the election.
As I said now 5 times to the follow-up.
White House Press Secretary Sean Spicer, appearing on camera before reporters for the first time in more than a week, could not avoid the subject.
It's not a question of new proof or less proof.
Spicer offered no evidence to back up his boss's claim. He said Mr. Trump had not asked FBI Director James Comey, whose office would have sought such a wiretap, whether it was true.
No, the president has not.
The White House insisted the president had nothing to prove. The obligation, it said, was for the House and Senate Intelligence Committees to investigate.
They have the resources and the clearances and the staff to fully and thoroughly and comprehensively investigate this.
The Republican chairman of those committees described the evidence as thin or non-existent.
I have not seen that evidence.
We don't have anything today that would send us in that direction.
During his confirmation hearing, Rod Rosenstein, nominated as Deputy Attorney General under Jeff Sessions, was equally skeptical.
That happened in the Nixon era. There was a question about whether presidents can wiretap without legal process. I believe it has happened before. I don't have any reason to believe it's happened recently, and I certainly hope it hasn't.
I mean, look at the tweets. I mean, the tweets are just incredible. On a Saturday morning that he would actually just, tweet this terrible. Just found out that Obama had my wires tapped to Trump Tower just before the victory. Nothing found. This is McCarthyism. This is Nixon Watergate, bad or sick guy. I mean, it is amazing to me that Donald Trump, I mean, you got to give him credit, I guess, on some level that he can build this kind of, I don't know, circus atmosphere to the point where everyone just kind of rolls their eyes and says, there's nothing to it, let's move on. This assertion is incredibly important and has to be investigated, and all he has to do is say, listen, I had a bad morning, but he won't do that. Stay tuned on that one. This is the day without a woman. I don't know. Look, as a guy who is really, listen, we don't have to compete for who's staunchly supportive of gender equity and gender rights. There's estrogen in my family. I have, 4 sisters. I have a wife. I have a daughter. Much more estrogen than testosterone. On the ground, I've been making this, a case for a long period of time. But when I see this garbage, it's just, you got to be kidding me. I don't have a problem that it's a national cause. Listen, you want to wear red and you want to support women's and small businesses and all that kind of thing, fine. But when it gets to this kind of nonsense, it's what? This guy is fishing for any politically correct pole he can tie his dog leg to. I mean, he's unbelievable, Mayor Elorza. He gives carte blanche for female employees to take a personal or sick day today. And what happened yesterday? Well, the city council that runs the municipal court canceled 75 cases because they didn't have enough employees to run the courthouse. Now, I heard this morning that there was some fledgling work being done at the courthouse, but I don't understand. I really don't understand. Listen, if I'm the mayor and I hear a percolating problem in the city that I'm not going to have a substantial enough people to run city services because of this thing, I'm sorry. I issue an edict that says, you know what? do what you want, but I'm checking personal and sick days for their credibility. And if we got a whole bunch of sick out based on this and we can't run city services, well, there's going to be some heck to pay, like discipline for employees. Kurt Schilling, critical of the 38 Studios document dump on the internet last week. Join the club, Kurt. Headline here, lawmakers question partial release of the 38 Studios documents. Yeah, they are a partial release, and Schilling is critical himself, saying this is ridiculous. Where are the key players? Well, Gordon Fox, the then Speaker of the House during all of this, and Mike Corso, the center of attention and the broker who put the deal together, and the former Speaker, Bill Murphy, really didn't have much to say. Murphy at least responded to the state police, and you see that dialogue in the documents that are on the state police website. But Fox wasn't talking, and Murphy's his lawyer, and Corso didn't talk. And of course, it could be cross-wired with the grand jury testimony, which now is under request to the Superior Court here in Rhode Island. Governor Raimondo has requested that the Attorney General bless and the judge authorizes that the grand jury testimony of 38 Studios be released. The other thing is, if you look at the list at the state police site, all the reps that were interviewed by the state police on that fateful vote, the loan guarantee program that authorized 38 Studios funding, they're listed on one side, and the Attorney General, and he's on that list, the Attorney General, because he was a former state rep, but his interview's not there. I don't know what games are going on between the Attorney General and the state police. They're not getting along very well right now. What politics are happening, but that's disgraceful. And I will tell you, the state police being non-responsive to the queries of the media about what's going on with this report, it's embarrassing. Colonel Osumpico has just taken over, and at least administratively, and I say this with my fingers crossed and praying to God for forgiveness, because the state police, I think, are the last bastion of integrity in this state. But she is stinking the joint out. I mean, really. All right. This is a really interesting conversation America is going to have with the American Health Care Act. Is that what it's called now? The American Health Care Act. It's not the Trump Care, as Governor Raimondo called it yesterday. A couple of headlines here. Yeah, they're fighting. The American Health Care Act, as opposed to the American Affordable Care, as whatever. It's a lot of A's in that. Republicans changed to Medicaid. Could have larger impact than the changes to Obamacare. I don't know how anybody's going to work this whole thing out. John Friedman's a professor of economics, international and public affairs, Brown University. You've been in the midst of this for quite some time. We've talked before, and I welcome you back. Thank you for joining us.
Thanks for having me.
The Affordable Care Act, did we talk about this last time? That I think if we could take the politics of the name Obamacare off the Affordable Care Act, the temperature might come down, and we might not be so heck bent on concepts of political repeal and replace, and just touch up and or renovate something that in part is working okay. Does that make any sense?
I think that's right, and I think part of the way that's reflected in what you've seen from the Republicans in the bill earlier this week is that it looks a whole lot more like Obamacare than I think many people expected when the process started. And exactly then, because of the politics, I think some of the conservatives are a lot more upset about what they've released because they thought that they were going to really go in a different direction, and they're not.
What would the different direction be?
Well, some people have proposed actually repealing and shutting down the exchanges or the Medicaid expansions that the large coverage increase in Obamacare rests on. And they haven't done that. They've switched around the subsidies a little bit. They've switched up the way that Medicaid's going to get funded. But the core architecture, support for states covering health care for individuals that are above the poverty line, individuals getting tax credits to buy health care on these exchanges is still there.
All right, we're going to break this all down here momentarily, give you a little bit of a presentation from the network, and then have Professor Friedman kind of go piece by piece and solve the whole thing for you before the end of the show. In the meantime, I just want to let you know that the folks at Navigant Credit Union urge you to try their Card Valet app. Now, if you're a member of Navigant Credit Union, you got no problem, just download it. If you're not a member of the Navigant Credit Union, all you have to do is open up an account and get yourself a debit card and then have it managed via Card Valet. The technology on your smartphone is phenomenal. The ease of service and being able to just evaluate everything you're doing banking-wise, literally from your smartphone with Card Valet, even more than regular online banking, is only believed when you see it. Check it out at Navigant Credit Union. Enjoy life's journey so many members have since 1915 at Navigant. Be right back. All right, here's what's happening sort of up to date on the latest on healthcare.
Republicans are pushing their new healthcare bill on Capitol Hill, touting it as a cure-all for the ills of the Affordable Care Act.
We need to move healthcare decisions out of Washington and send them back to the states and back to patients and families and their doctors.
The GOP proposal eliminates the individual mandate, employer mandate, and most taxes. It's replaced with a massive expansion of health savings accounts and refundable tax credits for low and middle income Americans who don't get coverage through their jobs, ranging from $2,000 to $14,000 a year. The legislation would still cover pre-existing conditions, dependent coverage until age 26, and waits until 2020 to roll back Medicaid expansion. Democrats say millions of people who just gained Medicaid coverage under Obamacare will lose it.
This is a tax cut for the wealthy with some health insurance provisions tacked alongside of it.
It's not just Democrats who could jeopardize the repeal and replacement of Obamacare. Some conservative Republicans have their own objections.
Basically, they're leaving taxes, they're leaving subsidies, and they're leaving in a form of an individual mandate. That sounds like Obamacare light to me.
The Trump administration is calling the bill a work in progress.
This is the beginning of the process, and we look forward to working with them and others.
Republicans need 218 votes to pass the bill in the House. Democrats say they won't be providing any of them.
All right, this is interesting. Two key things that the public loved about the Affordable Care Act. I don't want to say Obamacare because my thought is if we'd stop calling it Obamacare, the politics would come out and reasonability would enter. Having said that, Obamacare had the 26-year-old kid can stick on the plan and pre-existing condition protection. Those were two principal, not the only, but principal foundational identifiable pleasures that I think America felt good with. They remain, correct?
That's right.
So, repeal, this repeal would take those off the table too, and the repeal thing I think is a little overblown. The Medicaid thing is probably the biggest fluctuation here. I want you to dig in and really explain that to me. But the other thing that I've noticed in this thing is that the mandate and the tax penalties for not signing up for health care are going to go away. On that one, what's the motive to keep people in the plan? And if you don't have people in the plan who are healthy, how does the plan survive?
Right, so just to start with the mandate, they've removed the mandate as they had it before, where you paid a penalty every year if you were not covered. What they've replaced that with is a system where you don't pay a penalty when you're not covered, but then when you want to get covered again,
30%.
You have to pay more. So this is actually very peculiar.
What's the incentive? If you're not on a plan and then you have to get on a plan, you're 30% surcharged. Why would you get on another plan?
Except if you're really sick. And so what that means is that the people who are on the plans are not just going to be the people who are kind of sick, who wanted to get insurance, they're going to be the people who are really sick. And that could make the set of people who are in the insurance pool even worse than it is today, which then increases premiums and destabilizes the whole system.
Now look, coming clean here, I mean, you worked with the Obama administration on this stuff. I mean, you've been intimate on this stuff. Would you call yourself a fan of Obamacare?
I think Obamacare made some big steps in the right direction. I think that there are some elements of Obamacare that you could continue to improve on, and if the Republicans would set aside their obsession with repeal and replace and just think about, here's a system, how can we make it better? I think there are some real improvements that they could make, and not every idea that they put out in this particular package is a bad one, but I think that they're very concerned about not just changing Obamacare, but actually just making changes to Medicaid. These are people that have never had any contact with Obamacare. Even the people who were already covered by Medicaid before Obamacare came in are going to be hugely affected. And the reason is that they're going to change Medicaid from something that basically cost shares with the states, so if it gets a little bit more expensive, the federal government kicks in a little bit more, to a system where the federal government is going to give you a fixed amount per person. And it's going to depend on whatever people cost in 2016. So if costs go up a lot, the states are just on the hook. If a lot of valuable treatments come online and it costs more, the states are on the hook. And what that means is that, just think about a state like Rhode Island, we already spend about $1 billion a year on Medicaid, and that's just the state money. That's not even counting the money that comes out of the federal government. We're going to have to stump up about another $300 million in order to keep covering the people who are on Medicaid now. And that's only going to get worse over time.
Remind everybody, people on Medicaid are on disability. You know, Medicare and Medicaid sometimes confuse people. Medicare is the health care plan for those 65 and older.
That's right.
Healthy or not.
That's right.
Medicaid is for lower income and disabled.
Yeah,
for the
so
most part.
The disabled can be on either Medicaid or Medicare. But yeah, it's basically the health insurance program put on by the government for low-income families.
Right.
And what these changes are going to result in is that either Rhode Island has to stump up about another $300 million a year by the time this entirely goes into effect, or not the people at the very bottom, but the people earning maybe $25,000 a year in Rhode Island are going to have to pay a lot more for coverage. And in many cases, that's not going to be feasible for them. And we haven't had a formal estimate just because the bill's so new. But people are suggesting across the country maybe 10 million people would lose coverage as a result of these proposed changes.
I guess I'll ask you when we come back, what is the thinking? I'm just not sure what the underlying philosophy is. Stay with us. So, John, this is a fascinating exercise. Both the politics of promising something in an election, finding yourselves having been elected and now having to actually deliver on the promises that you're making with a system that is probably the most intricate and complicated, expensive, and hard to figure out thing you could ever try to handle. And so it's going to be a fascinating thing. I mean, even down to the idea that you know, subsidies for low-income people are going to go away, but tax credits are going to be introduced. Well, those who don't earn a lot of money, I don't know whether it's going to be like the earned income tax credit where they're actually going to get a check back for more than they paid.
So they will. So this is actually a huge contention for people on the right, which is that they hate what's called a refundable tax credit, which exactly as you said means you're allowed to get more money back from the government than you owed. Now, of course, if I'm trying to subsidize you to buy health care, if I don't make that much money, I don't owe that much tax. And so if I can only cancel out what little tax you do owe, I'm not going to be able to provide much of a subsidy to help you buy health care unless I'm willing to make it refundable. So this proposal keeps the refundable tax credits. They call it something different, but it's the same refundable tax credits as they had under Obamacare. It's just that they give a little bit more to the young and a little bit more to the rich relative to Obamacare, which had a little bit more for the old and a little bit more for the poor. So it just kind of reshuffles the chairs around. It doesn't really fundamentally change what's going on.
All right. This philosophy on the Medicaid change, you heard in the package, I think it was John Cornyn there talking about putting the responsibility back on the states. I guess it really does. In your formula, if Rhode Island's up to a $300 million hit here, $300 million in Rhode Island's budget against $8.6 billion in totality, really only about $3 billion that's raised organically.
That's right.
Here.
It's like 10%.
That's an incredible amount of
money. And I think that you exactly pointed out the trade-offs here. So what conservatives are going to like about this is they say, now states can figure it out, and if they want to offer more coverage, if they want to offer more services, that's up to them. They can make the decision correctly because they bear 100% of the cost. I think what liberals fear is that that's going to lead to big cutbacks in practice, either because the states are not used to paying that much out of their budgets and it's required to cut back on a lot of other stuff, or just because the states aren't going to be able to deal with big surges. Maybe there's something that's new and expensive and we really need to pay for it, and now the federal government's no longer there to help the states through the lean times.
What does this do to the insurance industry? Make it more flush, less flush? What?
So there'll be fewer people who will be covered. Predictions run either way. Some people think that because there will be a safer pool, insurance companies will make more money. Some people think we'll have
A
bigger
safer
problems.
pool, meaning?
Less sick people who are getting health insurance, because the poorer people who tend to have larger health problems will be forced out of the pool because they can't afford it.
I mean, let's just listen to what you just said. I mean, on a moral basis. Now, look, I don't position myself as a lefty liberal by any stretch, although a lot of folks this year have thought, because I'm not a big Trump guy, that I've gone to the left. There's a draconian aspect to this.
The United States is the only developed country in the world where, for tens of millions of people, they are one car accident away from bankruptcy because they don't have health insurance.
And by the way, bankruptcy means that nobody gets paid.
That's right. And that's right. You'd lose your home in many cases. You can't have a credit card. You can't get a loan. It's not, I think that we can all disagree about how much subsidy and how much care someone can get, but the notion that health insurance is out of reach for tens of millions of people, I think, is just fundamentally unsettling.
And the quick thing for people like me, for lack of a better term, working for a living, have a company health care plan, high deductible, whatever, most things won't change, right? When you have a private relationship with your insurance company.
That's
It's just a question of how healthy is your insurance company, and what kind of costs are they going to generate to those people who have that direct relationship.
Yeah, I think most things will not change for people who get coverage through their employer. And in fact, talk about all the things that won't change, perhaps the most hated part of the original Obamacare, other than the mandate, is this thing called the Cadillac tax. That's still there. They did not repeal it because they needed the money to pay for all the changes.
Meaning the higher value the plan.
For high value plans, there's a 40% surcharge that comes in that the companies have to pay. And they keep putting it back, so now it's been put back from 2020 to 2025, but it's still there. That's just one more thing that conservatives have found not to like in this plan. Then on the other hand, you have a bunch of moderate Republicans who come from states like Ohio that have taken up the Medicaid expansion. They're upset that so many people are going to get thrown off of Medicaid because the states won't have enough money. Really, there's no win here.
The impossible task in 30 seconds. Tell me what your prediction is here.
I predict that the bill will get more conservative as it moves through the House in order to satisfy all these conservative demands that we've been talking about. I then think they run into real problems in the Senate, which is a more moderate body, and where you just need to lose a few Republicans in order to not be able to get 50 votes.
Will we get change this year?
I don't know. That's a hard call.
It is a hard call.
50-50 pick 'em.
It's all right. There's no deadline on this. We'll have you back. Very
Thanks so
helpful.
much.
Very helpful. Thank you. Did you get all that? Final word when we come back. Alrighty. I'm really perplexed over what's going to happen here with this repeal and replace of Obamacare. You know what's really, really missing in this whole equation? Never, other than the politics of repeal Obamacare and replace it with something that is what? More affordable, more accessible, all those things. We've never really had a clear 5-point explanation of the stuff that's good and the stuff that needs to be changed. And you know why? Because that analysis isn't going to happen because the politics cover it up. See you tomorrow on the radio, too, on WPRO at 3.